Hi, my name is Dr. Matthew Weiner. I'm a bariatric surgeon in Tucson, Arizona. I also have a YouTube channel and I've written a few books. And through my social media outreach, I often get questions from patients. And over the last few weeks, I've been thinking to myself about a better way that I can interact with some of you out there so that you can direct your questions toward me. Because the truth is, if you're having this question, it's very likely someone else is as well. So what we've done is I've created on my website, drweiner.com, an area right down here where you just scroll down to this area and you click the button that says Start Recording. It'll work on mobile phones as well. And you can directly ask me a question. And then once you're happy with it, you can record it. You can send it to me. It comes to me by email, and then I'll make a video about it if I think it's something that other people would be interested in. And the truth is, most of the questions that I get, I'm going to make a video about. So if you have a burning question that you would like some more information about, then feel free to come to our website, drweiner.com, scroll down a few inches, and record a question and send it over to us. So the question that I'm going to start with today comes from a user, and these questions are anonymous, and in fact I'd prefer that you don't leave your name or any identifying information about yourself. So let's hear this question from a user out there.
Hello, Dr. Weiner. My question for you is, I had RNY gastric bypass surgery on December 26, 2018. I've had a lot of success with it. I've already lost over 140 pounds. I only have about 20 pounds to go to be in healthy BMI. I am wondering how long the gastric bypass malabsorption aspect will continue working. Will it always exist as long as I have the RNY in place, or does my body eventually just kind of go back to the way it used to be in terms of how it absorbs? I just want to know if I'm always going to have that tool with me for years to come. Thanks.
Okay, this is a fantastic question because it really gets down to the underlying idea of how these surgeries actually work. And the first thing I like to do is congratulate this person on really remarkable success. They're about 10 months post-op. I'm recording this in October of 2019. And so they're 10 months post-op. They've lost a significant amount of weight, and they're only a few pounds away from being in that BMI 20 to 25 range. So this is really an exceptionally successful patient. And I think that's an important component in looking at the answer to this question. So first, before we get into and answer the question, there's one thing I really want to correct in this question, and that's the malabsorption component. A lot of people think that a gastric bypass is a very malabsorptive surgery. Malabsorption basically means that the food that you eat comes in this limb of the intestines, and then the enzymes come through here. And so by separating the enzymes through the first portion of intestine, that you prevent your body from absorbing your food. But the truth is, when we really look at the malabsorptive effects of a gastric bypass, the way we do them now. Back 20 years ago, it was kind of anybody's guess in terms of how long these limbs would be. But truthfully, most people are making this green limb around 100 to 150 centimeters, which means about 3 to 5 feet. And this one is about 50 to 60 centimeters. This is not every surgeon, but I think the majority of surgeons are doing this. This is about 2 feet. And you have somewhere around 20 feet of intestines, less for shorter, smaller people, more for bigger people. So when we look at 3 to 5 feet here, 2 feet here, we're really just bypassing the first third of your intestines, and the last 2/3 really are able to make up the difference. So when we look at the components of a gastric bypass, it's actually the malabsorptive component is the least important. However, the most important is the one that a lot of people don't think about, and that's the hormonal effect. That there's these hormones like ghrelin and leptin and peptin YY, and really dozens, if not hundreds of others that we're just beginning to discover that are responsible for driving your weight loss down. So I think I'm just going to transfer this question to how long does this hormonal response last for? So let's just talk a little bit more about the hormonal response to bariatric surgery. This applies for sleeve gastrectomy as well. So the concept that I discuss frequently in a lot of my other videos, in both of my books, on the drweiner.com website, is this idea that our body fat stores are regulated. And I refer to this whole mechanism of regulation as your metabolic thermostat. And what that means is when you reduce your calorie intake, you impose a period of starvation, our caveman instincts kick in, and our hunger increases and our metabolism decreases. And the result is that your body starts to fight against your efforts at weight loss. If you eat a few more calories, the most common example I give is in the December holidays, and it comes New Year's Day and everybody's on their New Year's resolutions, your hunger decreases and your metabolism increases. So what we see here is that your body is working to keep your weight fairly similar, maintain it at the same level. We call that process homeostasis. So there's this inborn mechanism that's working to keep your body weight the same. Now, let's talk a little bit about weight loss surgery and this patient's experience. And I don't have the exact numbers, but let's say that the starting weight was around 300 pounds, and now they're at about 170 pounds. So what we see is that the hormonal influence of surgery has taken that set point of this individual's metabolic thermostat and essentially tricked their brain from thinking before that they were 300 pounds to now thinking that they're 170 pounds. So the result is you wake up that morning after surgery, your brain's at 170 pounds, your body weight's at 300 pounds, and so you're massively on this overfed side of your metabolic thermostat. So your hunger decreases and your metabolism increases. These are the exact changes we want to see if you're trying to lose weight. Trying to lose weight without hunger and with a revving metabolism is easy, and that's what we see in postoperative patients after surgery. This is the hormonal influence of bariatric surgery that is so vital to your success, and maintaining this very fragile balance, this improved hormonal state, is critical to your long-term success after surgery. That's where my nutrition program comes in. That's where all the counseling I do about avoiding weight gaining medications and all of the other things that I'm putting out there so that people are aware of this wonderful change that they've had, but understand how fragile it is and how certain things that you might not think about can contribute significantly to the destruction of this really favorable hormonal state. So, so how long does this effect last? Let me go back to the slide a little bit more. So what happens is right after surgery, when you're 300 pounds, you're 280 pounds, you're 250 pounds, you're still on this overfed side of your metabolic thermostat. So as your weight is dropping, you have no hunger and your metabolism is revving, and it's this amazing period. I call these the honeymoon years after surgery. And it's really powerful, and it allows for this weight loss to be very easy, and you feel really in control of your body weight. But eventually your body weight reaches your set point, this 170 pounds. And when that happens, you kind of go back to this state where if you reduce your calorie intake and drop below 170 pounds, your body starts to fight back against that. If you overeat a little bit, your hunger and metabolism will adjust to try to bring your weight back down to that normal 170 pounds. That's where your brain now thinks you should be. So now let's extend this a little bit. So in that first year or so, and sometimes especially for bigger patients, this could be 18 months to 2 years until your body weight reaches that new set point weight. This is easy. This tool is ultra powerful, and your risk of weight regain during this initial phase is very low. To the point where when I see weight regain in the first year, it's very worrisome to me, and it speaks to either a very poor genetic response to surgery or behaviors that are really challenging this hormonal state and driving that set point back up so early after surgery. It's actually very uncommon to gain weight within the first year after either a sleeve gastrectomy or a gastric bypass. So a thing that I think is so critical for every bariatric surgery patient to understand is that weight regain is common. It's not a sign of personal failure. It's a physiologic outcome after the surgery in a lot of people. It does not mean you're going to gain all of your weight back. It does not mean the surgery was not worth it. It does not mean that you are breaking all the rules and not doing things right. It just means that between this hormonal state and your genetics, at some point in time, you will face some degree of weight regain. And we see this typically after a sleeve gastrectomy. People start struggling with this at about 2 to 3 years, and a gastric bypass around 4 to 5 years. Gastric bypass surgery presents a little more durable weight loss, but it's not ironclad. It doesn't last forever. So to some degree, this is preventable. And I think at the very least, it can be minimized significantly to the point where it's maybe 5 or 10 pounds and no more. And this really gets down to recognizing the changes that this hormonal, the surgery has caused in terms of your hormonal state, and doing two things. The first thing is you avoid factors that cause it to go up. And now this is not just eating bad. This is consuming artificial sweeteners. This is consuming sugar-sweetened beverages. It has to be very specific. Consuming fast food or processed food that triggers us to eat more so than we normally do. It's taking medications that cause weight gain. It's injuring yourself and having a prolonged period of inactivity. There's a lot of factors that can cause this delicate balance to start going back up in the direction we don't want it to go. And the second thing to do is to maximize the factors that can cause your set point to go down. So number one, prevent it from going up. Number two, do whatever you can to keep it going down. There's 4 ways you can lower your set point. There's better nutrition, that's eating higher quality food, not less food. There's building muscle and using it. It's a little different than exercise. Very feasible for a 25-year-old. For a 65-year-old, this isn't so easy and typically isn't a very valuable or useful component of your post-operative weight loss plan. Doesn't mean you shouldn't exercise. It just means that exercise won't drive weight loss. Medications, and oftentimes, especially in this period when we start to see weight regain, in my patients, I use medications quite liberally and find them very helpful. There's some really good ones out there. There's some ones that may help a little bit. There's no magic in these, but sometimes they can give you just that extra little advantage you need to get that hormonal state back down to where you originally were. And then occasionally revisional surgery is how we can address this increasing set point. So for more information about this question, and again, I want to thank this person for submitting the question. It's an incredibly useful question. I'm sure it's something that's pretty much on every single post-operative patient's mind. But if you want more information, you can go to drweiner.com. I've got a bunch of nutritional courses and bariatric surgery courses. A lot of these are free. Course number 1 on nutrition really gets into this idea of your set point, the components that cause your set point to go up, and the 4 ways that you can lower your set point. And that course is free. There's a course on weight regain. That's bariatric course number 5. It's not free, but it's not very expensive. I think it's $20. And then I have 2 books that are available on Amazon. How Weight Loss Surgery Really Works, which really dives into this hormonal idea. Again, kind of addressing the components that cause your set point to go up, the things that you can do to lower it, and all of the other factors and how this way of thinking changes our approach to bariatric surgery. And then my book on nutrition, which demonstrates a way of eating higher quality food as opposed to less food, is called A Pound a Cure. Thank you very much for your attention, and I look forward to getting more questions and making more of these videos.